Hi, Dr. Nelson at Nelson Nelson Chiropractic Centers alongside Dr. Dominic Mancini. And today we're going to learn more about chiropractic. What is chiropractic? And how do we treat chiropractic patients? Chiropractic is a science based on the study of the vertebral column. The chiropractor works to adjust those vertebrae or manipulate the vertebral spine and the articulating joints of the human skeleton. Chiropractic works to reestablish joint motion, decrease pain without the use of drugs or surgery. What we have today is a small segment of the vertebral column. The vertebral column is made up of the vertebral joints. The vertebral body is the main segment of the vertebral column. Those two articulations between two vertebrae, which encompass the spinal cord and the spinal nerve roots. You can see the disc, which is between the two vertebral joints or vertebral bodies. The disc is mostly comprised of water. A disc herniation or bulging disc is a common condition treated by chiropractors. In addition, you can see the spinal segments. The spinal segments between each vertebra or each vertebral body is what causes the inflammation or irritation to one's spine or back. In between each vertebral joint is the important spinal cord. Chiropractors work to adjust the vertebral bodies between each joint to reestablish joint motion and decrease pain without the use of drugs or surgery. Today we're going to look at the patient's mid-thoracic area. There are 12 thoracic vertebrae in this mid-back. Those vertebrae are connected to 12 ribs on each side of the human body. Often patients will complain about pain into the mid-thoracic area. What we'll show you next is how Dr. Mancini will adjust this thoracic vertebra, thereby reestablishing some joint motion and function into the thoracic area and decreasing the pain. Next up, we'll see Hannah, who has suffered from mid-thoracic pain as a result of a work injury. Chiropractic's main focus is to reestablish joint motion and decrease the amount of irritation and inflammation around those joints, and often the resultant muscle spasm that is accompanied by thoracic pain. Let's take a look at how Dr. Mancini adjusts Hannah's back. Dr. Mancini is palpating the patient. Hannah's chief complaint is back pain. Today, Dr. Mancini is palpating the area of concern. Once he locates the specific area of concern, he aligns himself with the vertebral segment and then applies a slight pressure to that vertebra. Hannah's spine will make a slight noise. This is called a cavitation. Between each vertebral segment, there is fluid and air, and often an immediate relief or relief of pain is experienced. The gentle palpation of the human spine is Dr. Mancini's next step, finding the specific location of the area of complaint. Hannah has complained of back pain. Dr. Mancini's job is to locate that back pain and apply a gentle chiropractic adjustment, aligning himself specifically with the segment and adjusting that vertebra. Dr. Mancini is palpating the lumbar spine. The lumbar spine is comprised of 5 vertebrae. Hannah has complained of low back pain. She will lay in a side position while Dr. Mancini will position his fingertips along the vertebral segment, bringing the tissue segment to tension and then gently adjusting that segment. Dr. Mancini will gently palpate the segment of concern and then put a gentle force into that back segment, reestablishing some joint motion and some relief to Hannah's back.